Death is part of life, and death is expected. But when it's a death that happens on your watch, it's, you take a step back and you think, what could I have done?
I've been asked by 3 patients this morning how old I am and whether I'm qualified yet. She went, how long have you been a doctor? And I was like, I've been qualified for 4 years. She was like, OK, you can take my blood. I was like, thanks. Morning.
27-year-old Matt is among Kings A&E's newest recruits.
There's this thing when you apply to medical school saying, why do you want to be a doctor? When everyone is told not to say, I want to save lives, I want to help people. But why else would you go into medicine?
COPD, right, let's sort this man out. Oh, he's got a temperature. He's going to need an arterial, but I'll do a venous anyway.
Do you use your arterials?
Not at the moment. I know how to do them.
Yeah.
Let me talk through my arterial blood gas.
Medicine definitely not in the family. School's not even in my family. I was the first person in my family to do A-levels.
So I would feel for your radial pulse like this. And once I've got it strong, I've got it so strong underneath my fingers now. I can feel it pulsing underneath there.
Stop talking dirty.
I'm not. I'm just talking radial pulses here.
Go on.
My parents got a takeaway in just outside of Liverpool, which is where I'm from.
Straight in.
Yeah.
Bosh. Bob's your uncle, Fanny's your aunt.
Bish bash bosh.
Bish bash bosh.
Shall I show you how I do it?
Go on, show me.
They know I work shifts, but I don't really think they know what I do.
How many minutes?
5.
About 35 minutes.
We're getting to 1.
Paramedics are bringing in an elderly woman who they think is having a heart attack. Her children and grandchildren have come with her to King's.
Like you're a bit flattish for a second, is that right, Gil?
I'm just going to pop this onto your hand, OK, to take your blood pressure.
Trouble with her breathing. It's all over the place, there's depression everywhere on it. She's not complaining of chest pain at the minute, it's just the problem with her breathing.
Hello, my name's Matthew. I'm one of the doctors. You've met Kirsty and Laura. They're our super nurses. Do you have any pain in your chest? Has it got worse at all since yesterday? No. Do you feel short of breath?
I rarely let myself get involved in a family situation or in an emotional situation because you don't want to appear weak in front of patients or in front of their relatives.
How soon till she goes to CCU?
She's not going to CCU at the moment, she's not stable enough, he said. He said he's afraid she'll go along the way.
The elderly woman's condition is deteriorating.
How, Brady?
She went to 38.
OK. Can we get the paddles on her?
Paddle.
Yeah. She's got a pulse. Let's get another 12 lead.
I'm going to get the family to come in here because she's going to go in a minute.
OK. We need room 10. No, I've got a dying patient.
The next patient to arrive in resus is a terminally ill man.
Death is part of life, and death is expected. But when it's a death that happens on your watch, it's, you take a step back and you think, what could I have done?
Yes, Matthew.
So, Nine's just died.
Oh. Okay. Is there family or anything?
Yeah, so family are all there, family are all aware.
Okay. Oh. You can't be a doctor and not appreciate that people have to die. Even with all the best will, the best experience and skill, not everyone can be saved. And I also believe that, you know, sometimes not everyone should be saved. It's actually not in the person's best interest to stick them in intensive care on a ventilator and drag it out for another few weeks.
Two of these conversations in a day is just...
It's not your fault, Dr. Mac.
I know. I'm fine until the bit I write, may he rest in peace, and then that's just... I think if you don't feel like that when you certify, then you shouldn't be doing the job.
Well, write your notes and then go and have a break.
Yes, I will.
It's always something very poignant when the last thing that you write in the patient's notes are, may he rest in peace. It's one last dignified sentence.
Matt. You have a look.
Are the family okay?
Yeah.
Most of the time when I'm at work, I try and separate my family life and my work life.
Let's give it another few minutes.
I come from a very matriarchal family on both sides. My grandmother has got to this stage where she's got chronic health problems. And I guess I kind of saw it in that family.
Yes, hold on.
The grandmother was the head of the family, and seeing all her children, seeing her grandchildren all pile into resus, I think that was one of those moments when I thought, you know, well, that could be back home in Liverpool, that could be my family.
Go and have a little breaky break.
I just need to.
You need to go and have a break. I'll just order an X-ray and then I'll go and check he's all right.
Yeah, I just need 5 minutes of air.
Go upstairs, sit down.
I just need to certify first, and then I'll go, honestly. The phone's here, the notes are here. I'll be fine, promise. Frank, my name's Matthew, I'm one of the doctors. Nice to meet you. Do you have any allergies?
No.
Okay, and what do you take?
That's one good thing, isn't it? At the moment, I feel good.
You feel good?
Yeah.
That's the right answer.
Yeah.
The ambulance saved you.
Yeah. Yeah, good old Kings.
It's been one of those days. One of those days.
So tomorrow's better.
Hopefully I won't see you tomorrow. That'll be a good day.
With A&E, you need a bit of stamina. You need a good sense of humour.
Right.
Go. Thank you very much.
Thank you. Sayonara.
And you need to be able to forget everything when you leave because you know you've got to do the same thing again the next day.